Thank you very much, Mr. Chairman, and judging by the number of amendments, we may be all too functional. We're certainly a robust committee today. But good morning. I'm pleased to chair this subcommittee and to provide support for important programs that touch the lives of literally every American. The bill we will consider today provides increases to advance biomedical research, protect public health, and ensure quality education services for those most in need across our country. It does so in a fiscally responsible way by living within the agreed-upon budget caps and by eliminating low-priority or unauthorized programs in order to fund high-priority activities that benefit all Americans. The National Institutes of Health, our nation's premier biomedical research agency, is funded at $1.25 billion above last year, $2.25 billion more than the President requested in discretionary funding. We rejected the President's proposal to cut NIH funding for $1 billion within the bill. And we did so on a bipartisan basis. The NIH is working to find cures for Alzheimer's disease, cancer, and develop the next generation of medical treatment through the use of precision medicine techniques, and we need to continue to build upon the $2 billion increase we provided last year, not take steps backward. I understand my friends in the other body have provided a $2 billion increase for NIH again this year. I want to be clear that I view the mark we set forth today as a floor, not a ceiling, for biomedical research funding, and I'm hopeful that this number can increase as the process moves forward. The Centers for Disease Control, which protects our citizens against contagious diseases, as well as helped communities combat chronic diseases like diabetes and stroke, is funded at $800 million above the request, and with priority given to heart disease, stroke, diabetes, prescription drug abuse prevention, and antibiotic resistance prevention. The bill includes $390 million in funding dedicated to the Zika response effort and another $300 million to increase a new infectious diseases rapid response reserve fund, which will give the CDC director quick access to funding to respond to diseases like Ebola and Zika in the future without waiting for congressional supplemental process. We're all aware of the terrible toll that prescription drug and opioid abuse is taking on our nation. I'm proud to say that this bill includes $500 million for a new, first-of-its-kind, comprehensive grants program to enable states, localities, and tribes to develop anti-opioid initiatives focused on prevention, education, treatment, and recovery. And, Mr. Chairman, I'd be remiss not to point out your role in making sure that this funding was available and the leadership role you've played, frankly, for years in this particular area. Head Start receives a $142 million increase in this bill with a special focus on early Head Start for the most vulnerable children. Preschool programs are continued at $250 million, and child care programs receive a $40 million increase. Special education programs for students with disabilities are increased by over $500 million, a 4% increase above current levels, which will help local school districts ease the financial burden of providing specialized educational services to disabled and to special needs children. TRIO and Gear Up, which help disadvantaged students prepare for and complete college, receive a nearly 7% increase over last year. The bill also includes $1 billion for a new student support and academic enrichment program created in the recently reauthorized education bill. These funds can be used flexibly by school districts across the country, whether the need is in areas of counseling, school climate, computer science instruction, or other special curricula. Pell Grants are increased in the bill to the maximum grant of $5,935 per student. Due to significant carryover funding in the Pell Grant program, we've been able to dedicate fewer resources to this program in this bill this year, while still maintaining the maximum grant increase. The bill also protects the most vulnerable of our nation's people by increasing funds for community services program, the low-income home energy assistance programs, Meals on Wheels, job training programs, and programs supporting Native Americans, veterans, and people with disabilities. It fully funds the administration's request for Native American programs ranging from education to health care to improve services for a group that has historically been America's most neglected population. The Chairman's mark also includes several provisions that will prevent this administration from moving forward with various regulations that threaten to close down small businesses by imposing one-size-fits-all rules and costly mandates. The bill also demonstrates our support for the rights of all Americans, including our doctors and nurses, to be guided by their conscience in the performance of their jobs and not forced to pay for, perform, or refer for services they find morally objectionable. And the bill protects human life by continuing long-standing prohibitions against federal tax dollars being used to pay for abortions. Finally, this bill includes a provision that ensures not one dime of federal tax dollars provided to the Department of Health and Human Services through the bill can be spent in any way or to do any more work on the President's deeply flawed and unpopular health care law. I'm proud of the bill I present to you today, Mr. Chairman. It represents a balanced approach that will benefit every American and maintain appropriate stewardship to taxpayer dollars we've been entrusted with as members of Congress. Finally, I'd like to thank the staff on both sides of the aisle for their hard work putting the bill together: John Bartram, Jennifer Kama, Justin Gibbons, Lori Bias, Catherine Salmon, along with my clerk, Susan Ross, and the Democratic staff, Stephen, I'm going to stumble over this, Stephen Stelegder, Lisa Moynier, and Shaban Houlihan have worked long hours on the bill, and I'm grateful for their efforts. And I also want to thank certainly my ranking member, who's always a delight to work with. We sometimes have our differences, but we work together well and professionally. And, Mr. Chairman, I'd like to thank you and our distinguished ranking member for your help in the process along the way. So with that, Mr. Chairman, I yield.